Thank you, Nikki. Thank you so much for introducing and kicking us off. And I also want to just thank all of our media partners, as always, for being here today. We very much continue to appreciate everything that you do. We also want to thank you for amplifying our messages to the community across the state of Washington. We also want to remind everybody that it's Hispanic Heritage Month, September 15th through October 15th. And we want to recognize the incredible contributions of all Latinx Washingtonians across our great state. And we have a special guest today joining us, Dr. Leo Morales from the Latino Center for Health at University of Washington at UW, who will also be speaking shortly after me. And I just want to thank Dr. Morales for joining us today. We know it's the first day of fall today. It's been a long summer, which means we're in the middle of or beginning that start of flu season. And that is also important for all of us as we continue to remember COVID-19, but also remember that it's critical for us to make sure we take those same prevention habits in flu season, including all the things that we did during COVID-19. But certainly critical is getting our flu shot. So I know Michelle is going to be talking a little bit more about that, but I wanted to make sure that we were also recognize the importance of getting to your healthcare provider or to a freestanding clinic somewhere and getting your flu shot today. I know the focus has been on COVID-19 and Mpv and other diseases that are always in the headlines, but flu continues to be a significant cause of disease in our communities. The good news is that flu shots have now started to arrive in our state. And so we absolutely want you to get one and also encourage your loved one to get a flu shot today. Since the last time we met, as you know, Governor Inslee announced that the state of emergency declaration and many of the orders, the remaining orders, would be ending October 31st. And I wanted to make a few comments about that. As you know, we remain committed to the Walk Forward plan that we issued in March of this year. And we absolutely want to continue to advance our state together in full health and see the prosperity and the well-being of our communities continue to move forward as we continue to hopefully put COVID-19 in our rearview mirror. Governor Inslee's announcement that the remainder of the emergency orders will be lifted on October 31st is absolutely another crucial step in moving forward. And it shows that when we come together as a state, we absolutely can accomplish so much together. It's also an incredibly important milestone in our state. At this time, face coverings are still required in two particular settings, the healthcare setting as well as correctional facilities. Correctional facilities when there's medium to high community level transmission per the CDC. And this is as per the Secretary of Health order. We're in the process of having our team review the Secretary's order for face coverings with an eye toward when such requirements may be able to be pulled back. Given where we anticipate we may be with the beginning of respiratory season and flu season around the corner, as I just mentioned, we may simply not be there yet. So stay tuned for some additional information. I also want to make a couple of additional comments. As you know, there was over this last week, President Biden made some comments related to COVID-19. And I want to, first of all, say that we appreciate everything that our federal partners have done to pave the way to fight COVID-19. We could not have done what we have done in the state of Washington, the success that we've had in our state, without the support and the partnership of our federal partners. They have done that throughout the process when it comes to everything from material support to policy support, but also to vaccines and vaccinations. While the emergency phase of COVID-19 may be ending, we know that COVID-19 is still very much with us in our state. As a state, currently 7% of our hospital beds are occupied by COVID-19 related care. That's down from 11% the last time we met, August 25th. So we can show that. As you can see, the trend is going in the right direction. We're seeing similar trends nationally with a decrease of 16% from the previous week when it comes to cases and hospitalizations, a downtick of some 6% per the CDC across the country. But there are still some 300 Americans who are dying from COVID-related disease every single day, and that amounts to some 2,000 Americans a week. So we want to remind people to continue to be smart with their prevention and protection efforts. We can continue to be smart about those prevention and protection efforts, and that's how we're going to continue to be able to respond to COVID-19 in our state. In addition to that, we know vaccination remains such an incredibly important part of that protection, especially to reduce the chance of severe illness, the chance for hospitalization against COVID-19. The way we fight this virus is with both vaccinations, if it's a primary vaccine, or boosters, if someone has already received vaccine and is now eligible for booster dosing, as well as the other tools we have, such as masking and appropriate social distancing and ventilation. And that also includes antivirals and monoclonal antibodies and testing. Yes, the fight continues, and we continue with fulfilling our commitments as laid out in the WA Forward plan released, as I said, in March of this year. We're 6 months into that plan, and we feel things have absolutely improved as a state. This is a combination of people gaining immunity, whether it's through vaccination or through illness, but we are without a doubt in a markedly different place than we were in early 2020. I hope this also means that people will continue to get their booster shots, and Michelle will be providing more information on this shortly, especially with the bivalent boosters and the availability of that in our state. Let me go back to the WA Forward plan, and as we outlined back in March. When we released this plan, the focus was on 3 priority areas with 7 commitments moving forward. The 3 priority areas included engagement and empowerment, number 1, number 2, prevention tools and access, and number 3, system readiness, support, and capacity, as you see on the screen here. With engagement and empowerment, our main priority has been the health and safety of Washingtonians. And what we had committed to doing was to continue to monitor all the information that was available, the latest information with COVID-19, and getting that information out to people so they could then make the appropriate decisions to be able to protect themselves from this virus. When it came to prevention tools and access, we wanted to continue to support our vaccination efforts, but also have the stockpile of PPE that may be required if we had a situation where our healthcare system especially had a surge and or supply chain constraints. And fortunately, we have not been needing to use that in the same way over this last several months. With system readiness and capacity, we were looking at how do we genotype up to 10% of our COVID-19 cases. I'm glad to say that we have not just done that, we have at times even exceeded that, and employ key disease detection efforts, which includes the work that we have been doing related to our wastewater surveillance. As you know, we've been one of the leaders across the country when it comes to wastewater surveillance, and what does that mean related to COVID-19. We also had committed to maintaining visibility for our healthcare capacity in partnership with the Washington Medical Coordination Center and other healthcare coalitions. We have also done that, and we want to continue to really thank Dr. Steve Mitchell at WMCC for the incredible work that he and his team have been engaged in. Our approach was also equity-based, and the distribution of COVID-19 treatments and vaccines and therapeutics, and when we would have supply chain constraints, to give higher priorities to areas and or groups with higher disease burden and or reduced access. And that's exactly what we've been doing, including when we're working with our partners related to the bivalent vaccine. So there's a lot that's happening at the state level, but I do want to take just a moment to maybe take a big picture step back. Just this last week, we had the White House Office of Science and Technology Policy, OSTP, visit with Dr. Matt Hepburn. WA Forward was another example of our state responding robustly to COVID-19, and it absolutely takes all of us with these successes to be able to really continue to protect our state, but also to share those successes across the system. And that's what we did. We shared both our WA Forward plan. We also shared our transformational plan, which, as you know, we released several weeks ago. It's really an opportunity for us to think about not just COVID-19, but what happens post-COVID-19. What are the other gaps that we have across the health system, the health ecosystem in the state of Washington, and what can we do together so we can fill those gaps and also build a future that is very much about health in our state. We also shared many of the successes of innovation in our response, from caravans to Care Connect, WA Verify, WA Notify, Say Yes to COVID Tests, our VAC Center, our VIX collaboration, and certainly our data dashboards. What was key in our sharing with the White House was the fact that we could not have done this without our partners, whether that was partners in our public system, our health system, our private sector, corporations, small business, everybody coming together. Ultimately, this displayed that as we responded to this pandemic, we have been successful only because all of us have come together. And most importantly, that is the gratitude to Washingtonians for doing the right things to be able to fight this pandemic. Again, I want to thank Dr. Matt Hepburn and his team for the wonderful visit and his commitment to share our lessons and amplify those lessons across the country. We're very proud to be able to do that. As we continue in our work related to COVID-19, we know that the tools are available. It is now up to us to be able to use those tools and to be smart about our approach to health. Please get your COVID-19 vaccine or boosters and get your flu shot to stay healthy this season. Let me turn briefly to a couple of other things, and I will then turn it over to Dr. Morales. One is Mpv. So the exciting news is that we have added an Mpv data dashboard to our Department of Health website, and there's a screenshot of that, and thank you for our team to show that. It's similar to our COVID-19 dashboard. We wanted to be able to share as much information as we could related to, as you can see, a summary of what's happening overall, demographics, vaccinations, and certainly race and ethnicity information as well. These breakdowns also allow us to be able to share from a county by county standpoint, as well as overall what's happening in the state. As of September 19th, we have a total case count of 556 Mpv cases in the state of Washington. We have seen a slowing down of new cases being identified, and we are hopeful this is due to a few things. One, an increase in education and outreach efforts, especially to those people that are most at risk for Mpv. And number two, vaccinations getting to the very people that also should get them because they are most at risk for Mpv transmission. And then third, which I think is critical, is the prevention efforts that people have been taking to protect themselves and others, heeding the messages and being able to follow through on those messages, especially the message about if you have a rash that you have not characterized, you don't know what it is, you're not sure what it has not been diagnosed, it has not been seen by a healthcare provider, cover it, don't expose others, and certainly get it seen by a healthcare provider as quickly as possible. Today, we've had 16,715 vaccine doses that have been administered by providers in Washington. We've received just over 16,000 vials through phase 3, as you can see, 16,210. And we are just about to get additional vaccine from our phase 4 allotment, which, as you can see, is just over 2,500 vials. We've also been very mindful about making sure that we get vaccine to the counties where there is the most burden of disease, and also have some stock of vaccine ready if we have additional counties that come on board with an Mpv case. So Michelle's going to cover some additional information about that as well. I've said Michelle like 4 or 5 times. I think Michelle's going to cover almost everything then. With wildfires, I also want to say that much of our state is welcoming clear air today. I hope you are enjoying that. Some areas are still obviously being impacted by wildfires. If it's smoky where you live, please limit the time outside and avoid strenuous activities. Keep windows and doors closed and try to filter your indoor air. This is especially true if you have certain health conditions, if you are elderly, if you have asthma, if you have certain conditions that get triggered by smoke, by fire, by inhalation of particulates. We want to make sure you're doing everything you can to stay healthy and protected. You can stay updated on wildfire smoke conditions by checking the Washington Smoke blog. That's wasmoke.blogspot.com. And certainly, I want to make sure that everybody recognizes that climate change is really, again, one of the areas that we talked about in our transformational plan as part of our environmental health work. This is not just in the state of Washington, where we've seen floods, we've seen heat emergencies, we've seen smoke and wildfires, we've seen all sorts of challenges. This is across the country, and our hearts go out to those who've been impacted by Hurricane Fiona down in Puerto Rico and Dominican Republic and other parts of the Caribbean and the Southeast going into the Atlantic. We also want to recognize what's happening across the globe. And you have certain places where certainly, whether it's Europe that's having both heat emergencies and heat-related issues over the summer, or in South Asia and Pakistan, my native land, where you've seen a third of the country underwater. We know that climate change is incredibly important for us, and our continued commitment as part of our transformational plan to fight climate change in our state is so important. Let me close by saying it's been a tremendously challenging road over the last couple of years, and including this summer. We're hopeful that there are better times ahead. In our transformational plan, we speak to just that, how we're working together to ensure a brighter and healthier tomorrow. We've been on this difficult journey along with all of you. Thank you again to our media partners. So let's keep working together. Now let me turn to Dr. Morales for any comments, and then our team will go around with any additional comments. Thank you.
Well, gracias. Thank you for having me here today, and buenos dias. It's good to be here. I wanted to start by just making a few comments about the Hispanic Heritage Month, specifically about this is a time to really celebrate the contributions of our many different Latino communities here in our country and in our state. I specifically wanted to mention that there are, as I understand, 4 different themes to this Hispanic Heritage Month, including jobs and the economy, climate, education, and investing in HSIs, or Hispanic Serving Institutions, of which there are several in our state. And I wanted to call them out. Big Bend Community College in Moses Lakes, Columbia Basin College in Pasco, Heritage University in Sunnyside, Perry Technical Institute in Yakima, Wenatchee Valley College in Wenatchee, and Yakima Valley College in Yakima. Thank you so much for the work to all those individuals who are helping educate young Latinos here in our state. Finally, there's Mental Health and Wellness Month, and then the month will close. Before talking a little bit about COVID and MPX specifically, I wanted to make a few remarks about our population here in Washington State. Latinos number about a little over 1 million at this point and account for about 13.7% of the population. 76% of Latinos in the state are of Mexican origin. So this is an important characteristic we need to be aware of. Latinos as a whole are about 26 years. Their median age is about 26 years compared to 38 years for the state as a whole. So it is a young population. 72% are born in the US, so 28% are foreign born. 60% report speaking Spanish at home, and 79% of these individuals also say they speak English very well or well, meaning they are bilingual. So there's a lot of bilingualism in this population. In terms of health, it's a mixed picture with respect to Latinos in our state. Latinos have a life expectancy of 82.2 years compared with 80.1 years for the state as a whole. However, diabetes rates are higher. Hypertension rates are a little bit higher. Renal disease rates exceed that of the state overall, as well as obesity. So there are both positive and challenges facing the community in our state. In terms of vaccination rates, what we do know about flu vaccine, for example, is that only about 41% of Latinos have reported being vaccinated in the last 12 months, compared to 50% overall. So we need to do better in terms of outreaching. We know this with our efforts around COVID. And now I'll say in a few minutes, I'll say a little bit about what's going on with MPX. But in general, we still have work to do in this area of reaching our population with vaccinations. With respect to social determinants of health, Latinos face challenges. So approximately 13.5% of Latinos report food insecurity compared to 6.5% of non-Hispanic whites. 35% report financial insecurity compared to 20% of non-Hispanic whites. And 12.1% report crowded housing, of course, which is a risk factor for the spread of COVID and other infectious diseases compared to 3.5% of the population overall. Access to care is an important component of reaching Latinos in our state. And what we do know is that uninsurance rates are much higher among Latinos compared to this population as a whole and non-Hispanic whites in particular. Only 20% or approximately 20% report lacking insurance. Only 56% report having primary care compared to 75% overall. And what we know from our recent project we did at the Latino Center, only 3.1% of physicians report identifying as Latino. With respect to COVID and MPX or MPV, vaccination rates among Latinos have improved greatly over the last 2 years. We started out with a large deficit that grew, but I think through efforts through the state and through other healthcare, through our healthcare systems and our public health systems, we've reached many Latinos in terms of getting them their first or second vaccine. But we need to do better in terms of reaching Latinos and getting them the needed boosters, and in particular, the newly released bivalent booster. We know this is going to be important for the coming fall and winter term, and so we need to really now redouble our efforts in making sure we do that outreach. With respect to test to treat, and by that I mean identifying, helping Latinos identify who has tested positive for COVID and having them reach the necessary care they need. There's a wonderful new program that was launched several weeks ago, or maybe even a month and a half or so ago, that offers telehealth to Latinos for the purposes of administering or providing prescription for oral therapeutics, and if necessary, intravenous therapeutics at no cost. What we're doing at Latino Center and through the Adios COVID project is working with community-based organizations to reach those who are not connected with our healthcare system or any particular public health entity. We know that because of the lack of access, it's important to go beyond the walls of our institutions. With respect to MPV, our experience at UW suggests that Latinos account for approximately 30% of MPV cases, compared with the 13% of the population that they are. We know that we are not doing as good a job as vaccinating Latinos, at least through our UW experience, and in particular, those who are Spanish speaking. So we need to really think about how best, and need to continue to work to how best to reach and communicate with Latino and Spanish speaking individuals in our state. In summary, I think the state has to do better in terms of reaching our Latino residents. We need to engage with our communities to build a culture of health, as we are doing, but with more emphasis. We need to remove financial, cultural, and linguistic barriers to high quality healthcare. We need to build trust between Latino communities in Washington state and our health institutions and systems, so we can be effective in our efforts to improve health. And we need to eliminate interpersonal and structural racism from our healthcare system by creating a more diverse and better prepared healthcare workforce. So thank you for giving me this opportunity to make these comments. And I very much appreciate all the work that the Department of Health, in partnership with us and others, has been doing to improve the Latino community's well-being. Thank you.
Thank you, Dr. Morales, for that wonderful message. Next, we'll hear from Chief Science Officer, Dr. Kao-Sheng Huanget.
Thanks, Nikki, and good morning, everybody. For this morning's briefing, I'll be sharing some additional details on MPV. As Dr. Shah mentioned earlier, the weekly number of reported new cases has steadily gone down in recent weeks, so we're cautiously optimistic that our public health response against MPV is succeeding. However, it's too early to conclude that the outbreak is over, and we must continue to give high priority to vaccination and prevention efforts to maintain these gains. As Dr. Shah mentioned, Washington State has over 500 cases of MPV. Those cases are in 19 counties, with 80% of the cases reported in King County. As Dr. Shah mentioned earlier this week, we launched a new interactive Mpv dashboard to make data on the outbreak easier to access and to understand. And the dashboard includes case counts at the state and county levels, total weekly case counts, and age groups of people reported with MPV. And we are working to get additional data added to the dashboard, including race, ethnicity, and vaccination data. So we hope this resource will be useful to everybody, and it will be updated every Tuesday and Thursday. I'd like to give a reminder of how MPV is transmitted and how important it is for the public health and healthcare, how important it is for the public and healthcare providers to remain vigilant. As we know, MPV primarily spreads through close skin-to-skin contact with an infectious rash, scabs, or body fluids. And less commonly, it can also be spread touching objects, fabrics, and surfaces that have been used by somebody with MPV, and also by contact with respiratory droplets during prolonged face-to-face contact. It's important to remember that though this outbreak is disproportionately affecting the LGBTQ+ community, particularly gay, bisexual, and other men who have sex with men, anyone can get MPV. So for everyone, regardless of age, race, gender, or sexual identity, if you have an unexplained rash that you think could be monkeypox, even if it's just a few bumps, keep it covered, avoid skin-to-skin contact with others, and see a healthcare provider who can assess whether you need testing. And if you're positive for MPV, your healthcare provider can then help get you treatment if you have severe symptoms or are at risk for severe illness. And similarly, we urge healthcare providers to continue to be alert for MPV and to test patients on the basis of the clinical suspicion for MPV, not on the basis of their demographic profile. Regarding MPV vaccination, we're very proud of the collaborations with tribal and local public health to bring JYNNEOS vaccine to high-risk members of their communities. According to the latest Washington Immunization Information System data, more than 16,700 vaccine doses have been administered in Washington state, and a little over 3,100 Washington residents are fully vaccinated, meaning that they've gotten 2 doses of JYNNEOS vaccine about 4 weeks apart. In phases 1 to 3 of vaccine allocation, our state received more than 16,200 vials of JYNNEOS vaccine, and each vial can give an average of 3 to 5 doses. And this week, we ordered our first round of our phase 4 allocation, which is a little more than 2,500 vials of vaccine, and that order is on the way to Washington as we speak. MPV continues to not be recommended for the general public. Our priority is to increase vaccine uptake among those at high risk for infection, particularly to marginalized communities. CDC recently launched an MPV vaccine equity pilot program, which offers additional vaccine allocation to innovative programs aimed at reducing MPV in underserved and hard-hit communities. Equity in MPV vaccine and prevention efforts is a very high priority for DOH, so we'll be engaging with partners on opportunities to increase equitable vaccine delivery through this pilot. So in conclusion, we are very encouraged that MPV case counts seem to be slowing. However, it's critical that we not be complacent. Remember that anyone can get MPV, and if you have an unusual rash that might be MPV, avoid skin-to-skin contact with others and keep the rash covered until you can get it checked by a healthcare provider. And if you are in a high-risk group that's eligible, get vaccinated. DOH is committed to expanding access to communities most at risk because we are not safe from MPV until everyone is safe from MPV. Thanks, and back to you, Nikki.
Thank you, Dr. Huanget. Next, we'll go to Chief of Prevention, Safety, and Health, Lacey Fehrenbach.
Thank you. Good morning. Appreciate you all joining today. I'm going to talk a little bit more about the state of emergency. As you've heard many times from the governor and Dr. Shah here today, the state of emergency in Washington state will end at 11:59 on October 31st. Though we have come far, as you heard Dr. Shah mention, COVID-19 is still very much with us. It remains a leading cause of death in our country. Currently, there are over 350 people in the US dying daily from COVID-19. The good news is that severe disease and death are largely preventable with tools, prevention tools, if we all do our part to protect ourselves and others. The end of the state of emergency does not mean that COVID is over, nor does it reduce our commitment as a state or department to protect Washingtonians from COVID-19. It really marks a transition in how we're approaching the disease and using the public health infrastructure that we and our partners have built over the past 2.5 years and the tools that we have widely deployed together to keep our communities healthier and safer as we go forward into the future. The emergency declaration and many of the proclamations that are associated with it function to help us quickly mobilize and deploy resources across the state and into the healthcare system or to local public health. And they've helped us build a lot of really cool tools and programs. So things like the Caravan Vaccine and Booster Clinics, the Say Yes COVID Test Program, the WA Notify app, our Test to Treat program that Dr. Morales talked about to help people get antivirals quickly and easily. Those are things that will help us be safer going forward. The end of the state of emergency will impact how we resource some aspects of our response. However, our work and commitment to helping communities stay safer during COVID and with COVID will absolutely continue. One of the big changes is that many of our response activities are funded by FEMA reimbursement, and that will end with the state of emergency. However, the Department of Health will have access to coronavirus state fiscal recovery funds, as well as other COVID funding that we receive from the Centers for Disease Control and Prevention to help us meet our public health charge and the commitments we made and set forth in WA Forward. We have also submitted as an agency a budget request for consideration by the governor and legislature to support key COVID activities into the future. And our work will be guided, as Dr. Shah mentioned, by the commitments we made in that forward plan to make tools like masks and testing and PPE widely available to the public and the healthcare system, as well as to be monitoring for the next variant or subvariant, as well as understanding the burden and trajectory of disease and the capacity of the healthcare system. The scope and scale of some aspects of our readiness, response, and resilience supports may change over time, and that will really be based on the burden and trajectory of disease and what our communities need across the state. So one thing that I want to dive a little more in on is the Secretary's face covering order. Dr. Shah did cover this, but we are getting a lot of questions. So the first thing I want to start with is wearing quality, well-fitting masks is one of the best tools you have to protect yourself and others from COVID-19, influenza, and other respiratory viruses, which we're coming to the time of year where those are going to start picking up. The Secretary's face covering order in Washington State is issued under public health authority, and it is independent of the declaration of state of emergency and will remain in place beyond October 31st when the emergency ends here in Washington. And this is because COVID-19 is still with us. There's uncertainty that remains as we enter the respiratory virus season, and we really want to do our best to protect the healthcare system and our communities. So masks must be worn by all people age 5 and older in all healthcare settings, and this includes pharmacies and mobile vaccine clinics. So make sure you mask up when you go vax up this fall to get your bivalent booster. Masks must also be worn in correctional facilities when the CDC COVID community level is medium or high. You heard Dr. Shah mention this. The Secretary's order may be amended in the future and is likely to be amended in the future, but there are no changes planned at this time. Certainly things in consideration, will keep you posted. Beyond staying up to date on your vaccines and wearing masks, a few other helpful tips. Please stay home if you're sick and get tested if you're feeling sick. A reminder that even though the federal program has paused, Washington residents can still receive 10 free tests per household through the Say Yes COVID Test program, which has given out more than 10 million tests across the state of Washington since we started in January. You can also get up to 8 home tests per covered member under most insurance plans at pharmacies. We also encourage you to have a plan to access antiviral treatment if you're at risk for severe disease. So to wrap up, the end of the state of emergency is a significant, huge milestone for our state and for Washingtonians. And we know that it likely brings a variety of feelings to people and communities across the state: relief, concern, gratitude, to name a few. Dr. Shaw covered this well, but together we have come a long way in combating COVID-19, and we're on a good path to recovery and learning to live in a world with COVID. Please continue to take good care of each other as we go forward. Use the tools like boosters, masks, good ventilation, spending time outdoors, at-home tests, WA Notify for exposure notification, and antivirals for treatment to help yourself, your family, and your community stay safer. And I want to close with huge gratitude to everyone working in public health and healthcare here in Washington, as well as our community and private sector partners across the state. We are able to be and move into this next chapter together because of your efforts and your help. We know it has been a very difficult and a very long journey. And we also want to thank the people of our great state for helping us get to this chapter and part of the COVID pandemic, and look forward to continuing on our recovery together. Thank you.
Thank you, Chief Fehrenbach. Finally, we'll hear from Deputy Secretary of Prevention and Community Health, Michelle Roberts.
Well, good morning, everybody. I want to close this out and talking a little bit more about something my colleagues have already talked about, but the importance about protecting ourselves with vaccines in preparation for the upcoming respiratory illness season. And the key to that, as others have mentioned, is making sure you stay up to date on your COVID-19 vaccinations and get a yearly seasonal flu shot. This will help increase our protection as we head into the fall and winter seasons, when we typically see higher rates of respiratory illness. The updated bivalent booster will help increase protection against the most common Omicron variants. So vaccines and boosters continue to be the most effective way to reduce the risk of hospitalization and death, and keep those in our communities most at risk healthy and safe. Some good news I have to share is, as of this morning, over 173,000 people have received their bivalent booster. We expect these numbers to continue to grow in the coming weeks. Currently, there are over 700,000 bivalent booster doses available in our state of Washington, with more arriving every week. So there are appointments to be had, and if you've not signed up to get your booster yet, now is the time. And remember, you can receive either brand of booster as long as you've completed your primary series and it's been more than 2 months since your last shot. So if you're unable to find the same brand of booster as your primary series or your previous booster, it's okay to mix and match this time. We're also starting to hear from our federal partners that bivalent COVID boosters will also be available for ages 5 to 11 later in October. We'll have more information to share once we hear more information from our federal partners, but we're excited about the potential to protect more ages in our state and in our communities against the Omicron variant. COVID vaccine isn't the only vaccine people should be getting this time of year. We recommend that everybody aged 6 months and older receive a flu shot by the end of October. Young children, pregnant people, those with underlying health conditions, and people aged 65 and older are at high risk for flu-related complications. The flu is a highly contagious disease that can cause mild to severe illness and lead to hospitalization and death, even in healthy young people. Flu activity has been lower the last couple of years due to many people staying home and wearing masks. This year, people are more active and mobile. Many adults are working in person again, and children are back in school. This really creates opportunities for respiratory illnesses like the flu to spread. Preventing the spread of flu will be critical in the coming months to help reduce the strain in our hospitals and healthcare provider offices. You can receive your flu shot at the same time as your updated COVID-19 booster or with any COVID-19 vaccine injection. It takes about 2 weeks for the flu vaccine to fully protect you from the flu. So getting vaccinated sooner is better. The flu vaccine keeps most people from getting the flu, but some people can still get the flu after having the vaccine. If you are vaccinated and do get the flu, the vaccine will help reduce the severity of your illness. It also lowers your chance of needing to go to the hospital. So when you get the flu vaccine, you also protect your family and your community. And lastly, you can stop the flu by covering your coughs and sneezes, washing your hands for 20 seconds with soap and water, and staying home when you're sick. And importantly, as Lacey mentioned, masks also help prevent the spread of both COVID-19 and the flu. So it's really a critical time of year to ensure ongoing protection for ourselves and for our communities. If you're eligible for your COVID-19 vaccine updated booster, or you haven't received your flu shot yet, please visit vaccinefinder.org for locations near you. You can also call 833-GET-VAXXED for help finding a vaccine location. Dr. Shaw and Nikki, back to you.
Thank you, Deputy Secretary Roberts. This brings us to the Q&A segment of today's briefing. We have 3 reporters in the queue. First, we will go to Nicole Jennings with Cairo. Nicole, go ahead.
Hello, can you hear me?
Yes, we can hear you. Go ahead.
Yes, thank you. I'm wondering, we've been hearing from certain counties that some counties are seeing their lowest COVID hospitalizations in the entire pandemic. I'm wondering if you can give an idea. Does this seem, and I apologize, I missed the first part of the briefing because I was in a meeting, but can we really say, as the president recently said, that COVID is kind of on the way out, or what should we be expecting for the winter? Should we be expecting another surge, another variant? I'm kind of just trying to get an idea of if this is the best spot we've been in the entire pandemic, or if we should still be kind of worried.
Thanks, Nicole. I'll take that and then maybe kick it over to Dr. Quangetta and Lacey if they want to add anything to this. First and foremost, we did cover this really quickly, Nicole, at the very beginning on where things are with respect to this pandemic. I think the key message from us is that we're obviously in a different phase than we were, and we have all the tools that we did not have. If you remember 2 years ago when we were in the midst of just learning about this virus, we were hoping we would be able to get vaccines and antivirals and monoclonal antibodies and all sorts of therapeutics. At the same time, we weren't sure exactly how to use all the different prevention tools that were available. And so we're at a very different place now with an incredible array of tools. That doesn't mean that we have everything figured out, because there's still certainly twists and turns that this pandemic has shown us throughout this last 2.5 year journey. I will say that we do recognize that hospitalizations, which is one of the key metrics that we've been following, have decreased, as I mentioned, across the state and even across the country, which is great news. It's not surprising that certain communities are seeing decrease in hospitalizations from COVID-19 related admissions, and we want to continue to keep it that way. We don't want the burden on our healthcare system from COVID-19 to be any more so than it already has been, which has been tremendously difficult. But I will say is that, when we start to think about immunity, and we start to think about whether it's immunity from vaccines or whether it's immunity from illness or infection, we have to recognize that we still have a ways to go, that we are protected while we continue to be immune. But, obviously we need to keep monitoring what's happening when it comes to variants. We have to monitor what's happening when it comes to uptake of vaccines. And we also have to monitor the burden of disease, especially, as Dr. Morales mentioned, in certain communities across Washington where the inequitable impact has been felt. And that's not just for COVID-19, it's for influenza, it's for Mpv, it's for a whole host of different conditions. And so our goal is to continue to stay on it, but at the same time, we are feeling better and optimistic and hopeful for the future. That said, obviously we are staying vigilant, and we don't want to be in a situation where we let our guard down prematurely. So with that, Dr. Kwanget and Lacey, maybe some additional thoughts?
Yeah, thanks, Dr. Shaw. Yes, we are heartened that case rates, hospitalization rates, and death rates have been decreasing. Hospitalization rates are not yet down to the level that they were in late March, but they're definitely moving in the right direction. But yes, as Dr. Shaw mentioned, we have to be vigilant. We have to be vigilant for 3 reasons that Dr. Shaw mentioned. One is waning immunity in the population. The other is wintertime is a time when we normally see an increase in respiratory virus activity. And then the third is, Dr. Shaw mentioned, there's always the possibility of a new variant making its way onto the world stage. So I think that's why it's really important to get vaccinated and to get the updated bivalent booster, because that will help against the waning immunity that we have without the boosters. And by getting a bivalent booster now, you'll have stronger protection against not only Omicron variants, but also possibly new variants going into the winter months. Thanks.
I don't have anything to add other than, another plug to get your bivalent booster if you haven't. I'm scheduled to get mine tomorrow, and I'm very excited about having that protection from the Omicron subvariants.
Thank you. Our next question comes from Elise Takahama with Seattle Times. Elise, go ahead.
Hi, thanks so much for being here this morning. I think this would be for Michelle, but is there any sense or data yet about how flu shot rates have been, particularly among kids and teens as the school year has started? Like, have they been lagging at all this year, or are things looking pretty standard?
Yeah, great question. We do not have that data yet. We're actually working long-term on making sure we can have a flu vaccination dashboard, just like we have a dashboard for our COVID data. That will come kind of later this fall, and vaccinations are really just beginning. But we're watching that data closely, making sure vaccines are getting quickly out to our providers, including the state purchases all vaccines for children in our state and works with providers across the state to get those out. So that's really what's our efforts focused on now. We work with schools to make sure they're sharing information, and childcare is about flu. Often schools will have vaccination events and others. So we'll have data to share later this fall about how things are going.
Michelle, if I can just add one quick thing, which is this real concern that we may have to put out there, which everybody should be aware of, but it goes without saying. The last couple of years, we've had COVID-19. People have been wearing masks. They've been, social distancing. They've been at home. They've been staying out of their usual activities. We've had diminished, if not close to nil, if you will, very, very, very small amounts of influenza activity. It's not been zero, but it's been markedly less than we've had previously from a historical standpoint. This is going to be the first time where in a couple of winters where we are now going to not have people wearing masks and doing those same kinds of prevention and protection efforts that we've talked about. And it is really critical that we do not forget that prior to COVID-19, influenza kills Americans. Influenza is deadly. Influenza does impact kids. Influenza does impact adults. Influenza does impact elderly. Influenza does take its toll on populations that oftentimes are left behind. So we've got to continue to remind everybody, get your flu shot and remember those prevention efforts that have gotten us through COVID-19 and also will help us get through influenza season as well. Thank you.
Yeah, and one more thing I'll add to your point, Dr. Shah, about just what disease has looked like the last couple of years, which, as he mentioned, incredibly low. But I do just want to say we watch closely what happens in the Southern Hemisphere because they experienced flu season ahead of us, and they did have a flu season this year, and it spiked quickly and spiked a little bit earlier than past seasons. So that's one of the reasons we're getting out right now with our messaging and make sure vaccines are out there, that now is the time to get vaccinated against the flu.
Thank you. Our next question comes from Tim Gordon with KGW8. Tim, go ahead.
Hi, good morning. Thanks for having me. Yeah, I wanted to talk just a little bit more about masking. Understanding that still required in healthcare settings and prisons. But what's the beyond that? What's the message? Because Dr. Shah, you still got mask up Washington behind you, and George Washington's wearing a mask. It sounds like it's a really good idea in crowded situations still for COVID and influenza. So, I mean, what beyond the requirements? What are the recommendations specifically?
Yeah, thanks, Tim. And I'm glad you noticed. George Washington is wearing a mask, and as over the last couple of years, he was wearing it all the time, and now he's wearing it appropriately. And that's maybe the recommendation. The recommendation is when you are in crowded situations, especially indoors, that is where you really do consider getting that mask up. And so what does that mean? That means having a mask with you. If you don't have a mask with you, and there you go, I got my mask right here. I actually have 20 right next to me here. So Tim, if you want one, I've got one for you. The key message is if you're indoors, you're in crowded situations, absolutely be smart about it. Just protect yourself. That said, there's less risk when you're outdoors. It's not zero risk, but there's less risk, and just really need to be mindful of the equation of ventilation, what's happening with those who are close quarters to you, whether somebody is sick, when somebody is coughing, when you just don't feel comfortable in that kind of setting. That's when you put the mask up. And we have had, I will tell you, even my own kids, they have variably worn masks, even this school year. There are times where they've pulled them up, and there are other times where we've seen other kids who have continued to wear masks and the other kids who have not. And so I do think that the message from us is the recommendation is keep a mask with you. That's the first recommendation. The second recommendation is consider using it, especially in indoor crowded settings where you're concerned about those around you and or the ventilation. And number three is be careful even in outdoor settings. Although we know that the risk is lower in outdoor settings, it is not zero depending on what's happening around you. I hope that helps, Tim.
Thank you, Dr. Shah. This actually brings us to the end of our question and answer segment, and we will turn it back to you for closing remarks.
Well, actually, thank you. Thank you, Nikki. I want to first turn it back to Dr. Morales. I always like an opportunity for our guests to be able to say something. And, in particular, when we were making the comments around flu season, I thought that was a natural opportunity for Dr. Morales to weigh in. But Dr. Morales, first of all, again, thank you for your comments, for being here and your partnership and everything you've done to lead across our state. Anything you wanted to add, any closing message on either COVID, Mpv, influenza, or anything else that would be of benefit to our community members?
Sure. Thank you. Thank you for having me. It's really a pleasure to be here. Absolutely. I echo everything that's been said in terms of both protecting yourself and showing protection for others by wearing a mask. I think we take care of each other when we wear masks because we don't know necessarily who's might be currently infected and who might end up infecting a loved one. We do know that many people get infected in their homes. So, in fact, the majority of transmission happens in homes. And obviously, there's no intent there to do harm. So these protective measures are so important. I also want to echo the comments around the flu vaccine. I'm still waiting to get mine, but I'm very much, I'm going to take the first opportunity I get to get it, because the flu, although, in the last couple of years has not been as large a problem, I think with sort of the, where people are at in terms of masking and social distancing and so on, we're probably going to see a lot more of it. And it's going to cause people to be hospitalized, and unfortunately, there's mortality associated with the flu. So, we need to protect again ourselves and each other by getting vaccinated. So, absolutely, I'll be working through the winter and seeing patients, and also asking everyone to get vaccinated. It's so important. Thank you for the opportunity to comment.
Thank you, Dr. Morales, and thank you again for being here. Tal, Lacey, Michelle, anything that we may want to add before we close? Anything from the three of you?
Oh, maybe go ahead.
Just a note that we do have a number of caravan events that are providing boosters at college campuses across the state between now and the end of October. So that is an option, in addition to finding a vaccine on Vaccine Locator in your community pharmacy or local clinics. And definitely, if you have WA Notify, use that to notify your contacts. And if you haven't, we still have that program in place, and you can download it or activate it on your phone today.
And the only thing I wanted to share is I did get my bivalent booster on Friday. Felt a little bit tired on Saturday, but by Saturday evening felt great, and Sunday went on a nice hike. So I highly encourage everybody to get the bivalent booster and get strengthened protection against Omicron variants before the winter months. Thanks.
Thank you both. Michelle, anything?
I'll just add that, and Dr. Morales mentioned this about the importance of community partnerships and the importance of continuing to reduce gaps in equity and who's getting vaccinated. I want to share that we've been doing work behind the scenes to offer Mpv vaccination at within caravan events, and really starting to partner with community organizations to make that available. And the first event is this Sunday with a caravan event where they will offer Mpv vaccination, and that's in partnership with an organization serving our Latinx communities in King County. So really glad that we're continuing to use a model about how we could partner with communities to make sure we brought vaccine to people, as Dr. Morales said, out of the four walls of our traditional healthcare settings, in places hopefully people trust, and using that lesson learned from COVID, and now working to reduce those equity gaps we've talked about with Mpv vaccination.
I could not have said it better. Again, thank you to Dr. Morales, Tal, Lacey, Michelle. Thank you so much for joining today. Also, thank you to our media partners, as always, for amplifying our messages. A couple of closing comments that I want to make, and certainly, first and foremost, really recognizing that our fight is not over. We are continuing in our fight, both against COVID-19, now this new emerging virus with Mpv, and certainly with an existing virus that seems to emerge every respiratory season called influenza. And so please continue to be smart about how you can protect yourself, and also how you can prevent transmission across your family, your neighbors, and certainly your community. That's what helps all of us be successful. It was amazing, again, to have the White House team here last week to really see the successes that we in the state of Washington have had. And we have been successful, all of us together, all 7.8 million people across the state of Washington. And I would just want to say, we could not have done it without Washingtonians rolling up their sleeves, putting up their masks, doing all the different things that they have done throughout this last 2+ years. It has been difficult, and we know that it has taken its toll on all of us. And we just want to recognize how difficult it has been, but also the hope for the future. The other message that I want to just say again is those who are impacted by Hurricane Fiona, for example, in Puerto Rico, as well as the flooding that that has left the aftermath in Pakistan, as well as all sorts of heat and wildfire and other kinds of emergencies across the state, across the country, and across the globe. We know this has been a very difficult time. I hope you will continue to support those who have been impacted. I hope you will also consider contributing to help support that. There is a lot of need. I will tell you, from somebody who has been over so many hurricanes and flood events over the decades plus, I will tell you this has been the most challenging. It is always the most challenging time to be able to recognize the needs of people who are impacted when it is happening somewhere else. The other thing I would also remind people is that there are Washingtonians who have family members across the globe, across the country, in Puerto Rico as well, and we want to make sure that we're doing everything we can to give them the support as their family members are going through a very difficult time. And so I hope you will join in supporting Washingtonians as they continue to support their families and loved ones across the globe. And with that, I just want to say thank you to you all again. Remember, our transformational plan is on our website. We have a lot of incredible information on our website, including our new Mpv dashboard that is up. And we hope that you will continue to utilize that information to be able to help spread the word for the importance of prevention, safety, and health. And I do want to recognize that that is also Lacey Fehrenbach's divisional area, prevention, safety, and health. So Lacey, it's a shout out to you. And with that, I will turn it back to Nikki. And just thank you, Nikki, again, you and the comms team for the incredible work you continue to do to help support all of us.